Hello, my name is Chris Liu, PT, DPT, and in this short video I want to talk about pain and some of the ways that we can acknowledge and treat it. To start, it is important to understand the difference between what we call acute pain and persistent or chronic pain. Acute pain is the pain that we have shortly after an injury, such as when we sprain our ankle. In acute pain, there is actual tissue damage due to the injury, and this damage, as well as the body's response to the injury, such as inflammation, is the primary cause of pain. Acute pain will improve over time as the body's tissues begin to heal. Persistent pain, on the other hand, is more complicated. It's pain that lasts over a longer period of time than acute pain and lasts even after the damaged tissue has healed. While pain medications and anti-inflammatories often work to resolve acute pain, they typically have little effect on persistent pain. This is because persistent pain is multifactorial, with biological, psychological, and social components that make it much more complex and more difficult to treat or endure. While acute pain serves a biological purpose by letting you know your tissues are damaged and to limit activity, persistent does not have the same purpose. With persistent pain, the tissues have healed, and there really should be no restrictions on activity from a purely anatomical standpoint. There are two primary models that have been used in medicine when trying to explain pain. We call them the biomedical and the biopsychosocial model. The biomedical model is one that we've used for a long time, but is not always the most useful. It minimizes other contributors to pain, such as psychological, social, and cultural factors, and assumes there is an anatomical or physiological explanation for all pain. However, there are many cases of individuals with pain and no tissue or structural damage, as well as people with no pain who have significant anatomical abnormalities. For example, some research has shown that more than half of healthy adults with no low back pain demonstrate abnormalities in the spine, such as disc bulges. This suggests that a biomedical approach to explain pain doesn't always work. An alternative to this approach is the biopsychosocial model. This model de-emphasizes the purely anatomical explanation for pain and instead explains it as a more complex issue involving biological, psychological, and social components. In this model, we may not know exactly what is causing the pain, and that's okay. What is more important is treating the symptoms, focusing on health, and reinforcing positive behavioral responses to pain. When considering persistent pain, it is often more useful to use the biopsychosocial approach, given that there is often no clear anatomical cause or tissue damage to explain persistent pain. Essentially, this means it is important to not focus purely on the source of your pain and dysfunction. Instead, appreciate all of the physical and non-physical factors that may be contributing to it. Do you spend a lot of time thinking about your pain and the limitations it causes? And if so, is this negatively affecting your pain perception? Are you still able to participate in work and hobbies, or had to modify or cease these activities? Do you have a strong support system of friends, family, and loved ones to help you in times of need? These are a few examples of the psychological and social factors that may positively or negatively influence your pain. It is important to understand that pain is a subjective quality. What this means is that it is ultimately the brain that determines what is or is not painful. That's not to say that all pain is simply in your head. However, it does mean that the previously mentioned factors have a significant effect on pain. Having a positive outlook on the status of your pain, a regular exercise routine to increase dopamine and serotonin levels and elevate your mood, and not allowing your pain to significantly limit your activities can all improve severity of pain, even without any direct effect on tissues. In short, pain is a multifaceted, complex, and subjective experience that can be difficult to treat as a practitioner as well as endure as a patient. Everyone handles pain differently and finds their own way to cope with and improve it. Acknowledging your pain and finding out what techniques work best to manage your pain are both important parts of the process, and I encourage you to continue to explore these. I hope this video has been a useful introduction to the intricacies of persistent pain.